Right, hello, I'm Jonathan Rial. I'm a GP and I work with patient. I'm delighted to introduce today Charlotte Badescu, who's also a GP who has recently been diagnosed with ovarian cancer. She is here today to share her expertise with you. So, first of all, do you want to introduce yourself, Charlotte?
Yeah, so thank you so much for having me today, Jonathan. My name is Charlotte Badescu. I am a GP and I work in the northwest of England. As you mentioned, I received my own ovarian cancer diagnosis in 2021. So I've seen things both from a GP and a patient perspective. And now I work with the charity Target Ovarian Cancer. I'm part of their primary care advisory board. So we try to raise awareness, provide healthcare professional education, and various types of supports and campaigning to improve outcomes for ovarian cancer.
Thank you, Charlotte. I think the most important thing to talk about today is what sort of symptoms should our patients be looking out for?
So the most important symptoms that we might be concerned about are firstly, any bloating or distension of the tummy that the patient might have. So if you're experiencing sort of that your tummy feels a lot bigger, or it doesn't seem to fit your clothes as much as what it used to previously. Or indeed, if you're feeling fuller sooner, so you're not able to finish your meals like you were used to, just not feeling like it or feeling a bit nauseous halfway through your meal, that is a concern as well. And indeed, any pelvic pain or abdominal pain, so tenderness in anywhere around the abdominal region, we'd be worried about that. And then the final most worrisome symptom would be if there's a change to the waterworks, so urinary frequency, so you're going to the toilet to wee more frequently than you normally would or more urgently than you normally would. And if you've got one or more of those four symptoms and they've been happening at least 3 times a week or 12 times a month persistently, and they're not normal for you, that's something new for you, then you really should be thinking about going to see your GP, and we would be taking that very seriously and looking into more tests for you for those.
Okay. So I understand there's a family link as well. So if, for instance, one of the patients had a relative who's had ovarian cancer, should they be doing anything preemptively?
So it depends on the relative that's been affected by the cancer, and what the cancer type was, and what age the diagnosis was made as well. So it's really important, if you have had a relative or relatives in your family that have received the diagnosis, and you ask them all for the details and you make a note of everything. So anyone who was affected, what relation they are to you, which type of cancer, so it could be breast or ovarian cancer, because these can be linked. And then you go to see your GP to talk about it, because there are specific guidelines for GPs that are available where we're told exactly who needs to be referred on to a specialist genetics clinic, who are able to do more screening and tests for you to look at whether there might be a gene that's affected and whether you might need to be monitored further in the future, if you're at increased risk of breast or ovarian cancer.
Okay, thank you. So going back to a patient that has some of those symptoms, maybe just one or two of those symptoms, and you said go and see their GP. If the GP has concerns, what should they be expecting next? What would happen?
So usually after speaking to you and then examining you, normally, the GP would normally request a blood test, which is called a CA125 level. And that level can be raised in ovarian cancer. So if that level is raised, then the GP would normally go on and request a scan. So it's an ultrasound scan, and that would be done of your tummy and your pelvis. And that scan would also be an internal scan, so that they can have a look and see the ovaries in much more detail. It gives us a lot better imaging than it would do just on the outside of your tummy. And then the GP at the same time may request other tests or other investigations depending on what your exact symptoms are, but those are the normal tests, the first line that the GP might request for you.
Okay, thank you. And are there any other resources or any other tools that patients can be using before they go to see their GP that to sort of can make things easier during the consultation?
Yeah, so we'd always recommend writing down the symptoms that you've got. Target Ovarian Cancer has a really helpful symptom diary available in their resources. So you can download that, print that off and fill that in and bring that along to your GP appointment. And again, if your GP has referred you on to a specialist as well, you can carry on writing down your symptoms in that diary and take them along to your specialist appointment. If you've got any questions or concerns and worries about the symptoms you might have, or the tests that you're having, or referrals that you're waiting for, there is a specialist nurse advice line that's available via Target Ovarian Cancer. So you can find the number on our website. And they are really, really helpful nurses who are highly trained and knowledgeable about ovarian cancer. And they can really help to support and guide you through this quite difficult time for you. So I definitely recommend checking that out. There's lots more resources available on our website as well, so please have a read there.